Well, this pandemic has confronted NHS workers at all levels with an extraordinary challenge. Fergal Keane and cameraman Tony Fallshaw spent time with some of the teams fighting the virus at Imperial College Healthcare in London.
Dr. Ali Sanders is fighting a disease that has killed colleagues.
It's everywhere. You're reminded when you're cycling down an empty road that everyone's in lockdown. It's infectious, and we're coming to work. We're not locked in our homes, isolating from it. So we put some new signs up just to give a bit of clarity to exactly what we need to wear on red and super red.
Ali leads emergency teams at Charing Cross and St Mary's, two of the 5 London hospitals run by Imperial College Healthcare.
The team is now briefed for the day ahead, and what really strikes you here is the sense of calm and of common purpose. They're two vital things as the staff face this pandemic.
This is the resuscitation unit needed by some patients arriving with COVID symptoms. They're treated by staff in full protective gear. Movement is careful, words are soft-spoken. Part of an essential gentleness for patients who can't have relatives with them in this protected zone.
To have an infection that goes through the entire spectrum of age, that has limited treatment options, and takes out people who are largely otherwise well, with no particular rhyme or reason, is quite hard.
Staff announcement, it's Pinel time.
Every hour the staff disinfect their working area. Imperial College Healthcare has adequate supplies of PPE, but even so, there must be constant vigilance.
How do you deal with the anxiety?
I think it's just one. You just take one day at a time. I think if you try and think about the whole situation, it's too much.
There's been a massive reorganisation of staff as the hospitals have gone from 68 to 143 critical care beds, with a potential for 300. It takes many to wage this struggle, from the cleaner Raj at Charing Cross to the clinical trials manager Serge, who's become a ward assistant at St Mary's. Matron Dolores, who spent 40 years in nursing and wanted to pass this message to the public.
Stay home and not to put our resources under more stress than they are, that we don't want this spreading. It's quite simple.
For staff, it's deeply personal. 3 colleagues have died since the crisis began. The latest was 60-year-old nurse Melogine Ballesteros from the Philippines, a mother of 2 and one of 18,000 Filipinos working for the NHS. St Mary's is 175 years old, and sacrifice is part of history here. Staff fell in both world wars.
So if you come into this bit, then we need to close the door.
But in the spring of 2020, it's in critical care units like this that staff willingly face a potentially lethal virus. We were invited to see the work of the CPAP unit, where air is applied through a mask to help breathing. It can help some patients, not all. In the process, infected droplets are exhaled.
We use it for asking things to be passed through, so medications or equipment.
Staff communicate with the outside by video link. The ward is specially ventilated to create what's called negative pressure that stops any contamination escaping. A Hong Kong-born doctor leads the team.
What do you feel for the patients?
They're very isolated, they don't have their loved ones with them. They can't even hear us properly. I think it's a really scary time for them. And I think any small measures that you can do to make them feel more at ease, it makes a big difference. And I think doctors, we mainly sort of see the patients and then we pop in and out to see other patients. But it's the nurses who stay here for a long, long time. And that's what they need to recognise their hard work for.
Okay.
Nick, recovering, was deeply grateful to his carers, and having struggled for his life, there was a moment of clarity he wanted to share.
No, it's because of these guys I am sitting up, because I'll be honest, I never took it serious in the beginning. But after this, it's kind of told me slow down. Family, do you know what I mean? Being with your family is important. I'll do long, silly hours. but being with your family is really important, and that's what it's taught me.
I've just come out of the unit, and that word hero that's being used a lot of late has been going around in my head. And if you said it to anybody here, they would say, no, I'm just doing my job. This is what I've been trained to do. But having watched the doctors, the nurses, the ambulance people, the cleaners, the cooks, the porters, all of the people who keep this struggle against the virus going, people from the UK, people from everywhere, brave hardly begins to describe them. As Britain claps for its carers, emergency team leader Dr. Ali Sanders knows she's engaged in the greatest struggle of her medical life.
You know, it's just nice to like you being appreciated. Oh. You've done all this hard work. And I love you.
Her 9-year-old son Jack is learning the meaning of duty and of courage. Fergal Keane, BBC News.
Meanwhile, there's been a sharp fall in the number of people attending accident and emergency departments in England. It's feared people with serious conditions such as heart attacks or strokes are avoiding or delaying going to A&E for fear of coming into contact with the virus. Our health correspondent Dominic Hughes reports.
Accident and emergency departments are normally the busy front door to your local hospital. But the coronavirus pandemic is changing all that. Fears of contracting COVID-19 seems to be keeping people away. That's what stopped the father of 2-year-old Myla here from North London, who had to go back to A&E to have a cut on her head redressed.
Do we really want to be putting ourselves anywhere near a hospital at the moment? We had to do it the day before, but I think if we could avoid it, then we should. So after thinking long and hard about it and weighing up, have the NHS got enough on their plates already, we decided to not go and seek help elsewhere.
The latest figures from Public Health England cover more than 80 major A&Es. In the second week of April last year, more than 151,000 people attended emergency departments in England. This year, there were just 70,800 attendances, a reduction of more than half. On the face of it, that sounds like it could be good news for hard-pressed emergency departments. And the coronavirus crisis has undoubtedly put the health service under intense pressure. But health charities fear some people are reluctant to visit hospital when they should.
People are acutely aware that actually the NHS is under significant strain and they don't want to be a bother. But also, I think people are worried about being in a hospital setting because they don't want to contract coronavirus.
Some conditions, heart attacks or strokes for example, are time critical. The faster they're treated, the better the outcome. So any delay can have serious consequences.
If you were to have a serious heart attack and not seek help and not have the right procedure very quickly, then you are at a much higher risk of developing serious problems with the heart following this heart attack, such as heart failure or rhythm problems.
The message from doctors is clear. Even in the midst of the coronavirus pandemic, the NHS is open and ready to treat other urgent medical emergencies. Delaying treatment could threaten your life. Dominic Hughes, BBC News.